Jenna, thanks. Baystate Children's Hospital in Springfield seeing a spike in early cases of respiratory viruses.
And it's filling their hospital and emergency beds to capacity. So Baystate is urging parents to think twice before heading to the ER.
They're surging like it's the worst winter ever, and it's only early October.
A rise in respiratory bugs striking early.
We had more admissions in September to Baystate Children's Hospital for respiratory disease than in the 8 years I've been here.
Pediatrician in chief at Baystate Children's Hospital, Dr. Charlotte Boney, tells Western Mass News COVID-19 disrupted the typical pattern of seasonal viruses, resulting in the earlier than usual spike of respiratory illnesses.
So it's like kids who haven't seen these viruses because of all the infection control practices for the last couple of years. These viruses are back and making people sicker than they ever have before.
Dr. Boney tells us their emergency department is filled with children. Half of them have rhinovirus, the primary cause of the common cold. RSV is also on the rise. It starts like a cold but can spread to the lungs and is very dangerous for babies and toddlers.
But right now our emergency room is full of folks that have these respiratory illnesses but aren't quite that sick.
With full capacity causing long wait times, she says to think twice before coming to the emergency room. Call your pediatrician first if your child has symptoms like a runny nose, a cough, fever, or sore throat. Go to the ER if your child has difficulty breathing, isn't drinking or urinating, their fever isn't improving, or they have underlying medical problems like asthma.
When those symptoms become severe, particularly the cough, you start having trouble breathing. You can't catch your breath.
Dr. Boney says she's especially concerned about this spike in illnesses as all signs point to a bad flu season, which hasn't even begun yet.
So we're really worried about the winter and flu. So please, people, get your flu vaccine, get a COVID-19 booster if you're eligible. And remember, all those infection control practices that worked for COVID-19 will work for these viruses too.
And also of note, Australia, where winter spans April to October, is having the worst flu season they've seen in 5 years, which U.S. health officials say could be a sign of what's to come.